Good afternoon, everyone. So I know some people were saying they couldn't hear the audio. We are just now getting started, so hopefully everyone can hear. So welcome to our webinar, PrEP Navigation, Tips, Tricks, and Best Practices. So this webinar is part of the California State Office of AIDS Prevention webinar series. My name is Linda DeSantis, and I'm a program manager with the California Prevention Training Center in Oakland, and I'll be hosting today's webinar. This webinar is sponsored by the California State Office of AIDS Prevention Branch in collaboration with the Pacific AIDS Education and Training Center and the California Prevention Training Center. We also have the Curry International TB Training Center helping us produce the webinar with their technical assistance today. So all three of our training centers have a national and international focus, providing training and technical assistance to public health departments, CBOs, and private health care settings to increase capacity of the public health workforce in HIV, STD, and TB programs. We've collaborated for many years and find that our training audiences cross over, so it is good for us to work together on this. Before we start with today's presentation, I want to cover a few housekeeping items. First of all, we are recording this session for future reference. The link will be sent out to all of you who have registered, and we'll be sending that with a PDF of all of the files. It will also be available on the CAPTC and the PAETC websites for review, or for people who were not able to attend today. We'll be using the chat box to take questions since this webinar is in listen-only mode. Please type in your questions as they come up, and at the end of the presentation, we will address any questions that pertain to this webinar. Any questions that we are not able to cover, either due to the content being beyond what we're presenting or with time, will be collected and responded to, and then will be sent out to everyone after the webinar. So just for a little practice, I would like to ask everyone who is logged in and watching with a group of coworkers to type in the chat box the number of people that are with you in the room. Great. I see some people responding. Please keep going. We're trying to get a better sense of the reach. Okay, great. I see people responding. So thank you for that. It really does help us have an idea of who's listening in and sharing space with your coworkers. So if you need assistance during the webinar, you can raise your hand by going to the icon at the top of the slide set. You'll see the little person up there that looks like he's raising his hand. And that will come up next to your name that we, as the host, will be able to see, and we will check in with you via private chat to see how we can help you so as to not interrupt the presentation. If you are experiencing any delay in slide advancing or audio during the webinar, this is likely due to a slow network connection, probably at your setting. Please be patient. Usually the audio is fine, even if the slides do not advance in sync. This is a problem that is, if it's not on our end, we really can't help you, but rest assured you will get the recorded version and the slide set post-webinar. So today's webinar highlights how to help your clients navigate PrEP. We'll learn about the different medical plans which cover PrEP, and we'll discuss best practices to help advance PrEP access for your clinic. Presenting today, we have Felipe Flores, who is the manager of PrEP benefits and navigation at the San Francisco AIDS Foundation. Felipe received his bachelor's degree in sociology at UC Berkeley and began working in PrEP-related services in 2013. As a queer Mexican Salvadorian and San Francisco native, Felipe centers queer and trans communities of color in all of his PrEP-related work. Since his time as PrEP benefits manager, the PrEP program at Magnet has doubled its PrEP uptake among communities of color. Felipe and his team continue to enhance their program, focusing now on adherence strategies, and is happy to share the work and systems they have put into place. So I want to welcome Felipe, and we look forward to hearing what you have to say.
Thank you for the introduction, Linda. So like Linda said, my name is Felipe Flores. I'm the manager of PrEP benefits and navigation at the San Francisco AIDS Foundation. So for the presentation today, this is an overview slide of kind of how I wanted to set it up. So talking a bit about the clinic that I work at, the Magnet Health Clinic under the San Francisco AIDS Foundation, some of the history and the work that we do that, in regards to PrEP. And then going into PrEP navigation at Magnet, so kind of the day in the life of one of my navigators, the different systems that we have in place to kind of do the work that we are doing. Then I'll go into some of the best practices, so different strategies. So when we're, a lot of the conversation looking at like adherence, looking at ways to maximize navigation, so different tips and tricks that we've come up with over time. And then looking forward, so some of the things that are yet to come, in regards to PrEP and things that can enhance future programs. So I did want to preface that some of the navigation resources that we utilize in the slide deck, we won't be going over during this presentation, but in the slide deck that gets sent out, we'll have a full kind of like a full guide of how to really maximize those resources, since it's something that you can kind of see off of a slide, so I didn't want to spend too much time chatting about that. So before we get started, I just wanted to kind of poll the people on the call to see who is really on the call. So whether you're a prescriber at your clinic, if you're a navigator at your site, if you're a community member learning, wanting to engage more with PrEP navigation, or if you're something other, like maybe a pharmacist or maybe a pharmaceutical rep or something along those lines. So we'll give it a little minute to give people some time to vote. Great. So thank you all for voting. I think we're going to be able to share the results, right? Cool. So it looks like majority of y'all are others, so that can be a whole lot of things. And then we have a good chunk of folks that are navigators, so that's great. That's awesome that your sites have navigators, and hopefully this presentation will benefit y'all. All right. So the second poll before we get started is seeing where people are located. So this presentation is with the State Office of AIDS of California, but we know that folks throughout the country are looking to engage with PrEP navigation. All right, thank you all for voting, those of you that were able to. It looks like the good majority of y'all are from California, so some of the tools and resources that I'll be sharing are California specific, so I think that'll be great. All right. So first we're going to talk about the Magnet Health Clinic. So we're located in San Francisco in the Castro. We have two sites. Primarily in the Castro, which is where Magnet is located, and a downtown site that I'll talk towards the end of the presentation. Last year, we saw roughly 7,000 unduplicated clients throughout the entire year. So a lot of those folks come in multiple times during the year. Some of them are one-offs, but we saw about 7,000 unduplicated clients. We launched our PrEP program in November of 2014 as a pilot program. So it was meant to be a pilot of 25 people, and then word of mouth got into a community, and it grew and grew, and it became this kind of like huge resource in the community. Since then, we've initiated over 3,200 individuals onto PrEP, and we currently have about 2,200 still on PrEP in our program. So the reason for the discrepancy typically is people will move outside of San Francisco. The cost of living is extremely high, so some people will move to somewhere more affordable throughout the country. Sometimes they have a change of insurance, Kaiser being the biggest one that we're not able to see in our clinic, so we navigate them to get PrEP at Kaiser or with their primary care provider. And then, of course, you have people who discontinue based off of a lot of different reasons, whether it's a change in risk or it just doesn't make sense for them to be on it at the time. This projected fiscal year, we're looking to enroll 1,200 individuals, and we're on track for that. So I'll talk a little bit about the numbers later on in the presentation. All of our testing and medical care at Magnet is free. So through different grants and partnerships with different labs, we're able to offer all of our services for free. The cost of Truvada or PrEP is covered by insurance and different copay assistance programs. So Magnet is the clinic inside of Strut that is part of the San Francisco AIDS Foundation. So there are a lot of layers to it. I personally use Magnet when I refer to the clinic itself. Strut is the building with about 13 different programs and services just in-house in that building. We are also a nurse-led clinic. So we're the world's largest nurse-led PrEP health program. So we're able to do all of our PrEP enrollments and follow-ups with nurse practitioners and resource nurses through some of the laws in California. All right. So a PrEP enrollment visit will typically follow this flow, where individuals will go to a lab, get the different blood work that is done for PrEP. So that's Hep B, HIV, a kidney check, Hep C, and then they'll do an STI testing, which covers syphilis, chlamydia, and gonorrhea, and then go meet with one of our nurse practitioners to do the full evaluation. So the full evaluation covers a physical, a family history, the ins and outs of PrEP, and answer pretty much any question that the client may have in regards to PrEP. Assuming the labs come back fine and the client is still interested in going on to PrEP, then they'll meet with someone on my team who will handle their benefits. The entire visit takes roughly 90 minutes. We are a same-day start PrEP program, so individuals, pending their insurance, will get a prescription that same day. In terms of their follow-up, after the initial enrollment, we do a 1-month follow-up, which allows us to, again, close out their window of HIV depending on any potential exposures they've had in the past, do a kidney check just to make sure that the Truvada hasn't affected their body in any way after the 1 month, and check in about any potential side effects that someone may have experienced. Typically will subside by the 1 month. Then after the initial 1-month follow-up, it goes into every 3 months. With the 6-month visits, we'll have a full kidney check and meeting with nurses to make sure that everything is still in line to continue PrEP. With the 3 months in between those 6-month visits, where they'll have an express model, which is similar to Kaiser, if people are familiar with the Kaiser program, where people get their blood drawn, self-swab, and are in and out the door. So it creates more space for people to be able to access follow-up appointments, and they get in and out the door faster. So that's kind of a rundown of what the general flow looks like at our clinic. In regards to PrEP, we do offer other services. So we do full treatments for all the STI test board. We've been piloting a Hep C treatment program that's been a great resource in the community that I'll talk about primarily at one of our other sites. But now I'll go more into PrEP navigation at Magnet. So in this kind of section, we'll talk about what PrEP navigation is. PrEP navigation looks like a lot of different ways depending on the site that you're located and the staffing and the systems you have in place. We'll go into PrEP and PEP enrollment and what my team does specifically to support those. go into advancing access, so one of the assistance programs that's popularly used for uninsured individuals and people who don't have Truvada coverage with their insurance. And then we'll go into some of the refill requests and express refills that my team does before going into best practices. All right, so PrEP navigation. So PrEP navigators support individuals in their efforts to navigate healthcare and social service systems to access PrEP and PEP services. So some of the different tasks that navigators do is eliminating the barriers to access PrEP in regards to health insurance, minimizing the costs associated with their prescription, provide ongoing support in the form of pharmacy and insurance assistance, and provide adherence tips. And navigators are typically the primary point of contact for individuals at their clinics. That can change depending on the setup and what type of case management that your clinic or site may have. But navigators tend to be a really good point of contact, and you'll see it in kind of the work that my team does and why that's the reason for it. So going back to the flow in our clinic, so the navigators at our clinic are the last person that they see. So after they've done the full enrollment with our nurse practitioner, then we'll get the call to go and see the client to do all of their navigation. The first thing we do is ask what type of insurance they have, if they have any type of insurance. So one of the challenging parts with our healthcare system is that individuals aren't really taught about what their health insurance is, what it covers, what it doesn't cover, how to use it in any capacity. So a lot of what my team does is educating individuals on what their health insurance actually is, what it covers, how to use it, if they have any pharmacy restrictions, going over the ins and outs of that with them. Then, depending on their insurance situation, we'll apply to different assistance programs. That can be anything from just activating a Gilead copay card, if they're commercially insured. That can be explaining to them the ins and outs of Medicaid or Medi-Cal, if they're insured through there. Going over Medicare, which is a whole other beast when it comes to health insurance. And if they're uninsured, then applying to the Advancing Access Program. Another thing that my team does is we send the prescription. So after we've talked to the client, got in all the assistance programs for their insurance, then we'll select the pharmacy with them to send it electronically. We scheduled a 1-month follow-up. So again, the 1-month follow-up allows us to check in again about any potential side effects and see if they're having any issues after the initial 1 month. And then lastly, we provide adherence tools and support. So we provide a 7-day pill dispenser for individuals that are enrolling, so it helps people remember to take a pill daily if they're not used to it. We go over different strategies with them and just kind of hammering in the different resources that individuals are able to, sorry, I lost my train of thought. We provide all the different adherence tools for individuals, so different tidbits like setting alarms on your phone, building into routine, and just seeing what it looks like for individuals to be able to access the medication and stay on it. So Advancing Access is a program for individuals who are uninsured or have no Truvada coverage with their insurance. So in San Francisco, there's a program for undocumented individuals called Healthy San Francisco that covers kind of emergency services, but doesn't actually cover the prescription of PrEP. So for individuals who are undocumented, uninsured, or underinsured, meaning they have no Truvada coverage, Advancing Access is a great resource for that. There is an income threshold to be on Advancing Access, which is 500% of the federal poverty line, which comes out to about $60,300 yearly. So for individuals that make under that, they're able to access Advancing Access to have their prescription covered in full. So undocumented people are able to access Advancing Access. We've had individuals on the program for years and years, or upwards of 3 to 4 years now, and we continue to reapply depending on their insurance situation. So I'm not going to go too far into the program itself, since by looking up Advancing Access, you're able to kind of like read through the whole, like who qualifies and how to qualify. What I'm going to go into are different tips and tricks in terms of maximizing your actual usage of the program. So for Advancing Access, one of the great tools that your site can utilize is having designated agents. So at our site, we have 3 dedicated agents at Advancing Access that solely look at our applications. So what it does, it allows for a quicker turnaround time with our applications, where we have same-day or next-day enrollments onto Advancing Access, allowing uninsured individuals to access their prescription sooner rather than later. It allows us to build rapport with our different agents, so we can troubleshoot with any applications or any clients. Sometimes we've been able to get people on the program who may not have qualified otherwise, but because of our relationship with our agents, we're able to explain the situation in regards to that client a lot better than if we're calling in and just getting a random agent every single time. In order to have an agent assigned to your site, all you have to do is request for a manager while on the phone with an agent, and they'll confirm your site's information, and they do check to the volume of your site. So unfortunately, not all sites are able to access this. It's really only for high volume sites. The specifics of what that actually looks like, I can't really say, but if you are a site that doesn't have too much volume in regards to Advancing Access, then you could potentially partner with another site to have like a joint agent for both of your sites or multiple sites, depending on what your city or your different like HIV-related or PrEP-related services looks like in your area. So some of the other tools that we have in regards to Advancing Access, we have a cover letter template. So this is just a quick thing. Like, templates are great for everything that you're doing. It cuts down time so you don't have to create things all the time. The cover letter is great because it allows you to kind of add information about the application. So you can put in at the top if it's a PrEP application. You can put in if the client is undocumented, so you make sure they get the full 6 months of the program. You can put different information in the cover letter to preface the application so that whoever is, if you don't have a dedicated agent, whoever is like overseeing your application has the necessary information of what the client's insurance situation is or anything of that sort. Having templates for the actual application, a lot of it can be pre-filled before you actually meet with the client. And a lot of the information that's actually client-specific, you don't actually need the client in the room with you to be able to confirm. So you can submit the applications without the client as long as you have their consent and you verified all the information. But creating a template for all of your prescribers at your site that just pre-fills all of the blank documents, so you don't have to spend so much time just filling out applications, and the majority of it can be done and just streamlines your process a lot faster. So this is kind of the biggest tool in regards to Advancing Access that my team and I have kind of created. It's tough to see on the slide. If people want kind of a blank form of this spreadsheet, I can send it out at the end. It was kind of hard to make it fit in this presentation. But this spreadsheet, so at our site, we have anywhere from 350 to 500 clients on Advancing Access at any given point throughout the year. So this spreadsheet allows us to keep track of our clients in a really intentional and meaningful way, where we have all of the information that's needed within this spreadsheet. So we have like the client's name and date of birth, who faxed the application and when it was faxed, and the zip code of the application of the client, just because when you're calling in for member IDs, you'll need to verify their zip code, so it's easier to just see it on the spreadsheet than have to go through your documents or go through like someone's account to look that up. And then any comments. So you can put if the client is Medi-Cal or Medicaid eligible. You can put if the client is undocumented seeking asylum. You can put if they're like what their income is, if they qualify for Covered California or any of the Affordable Care Act programs, or really like any comments that would be meaningful for you and your team to know about the specific client. And then in the green section, it goes into the date received. So with our site, because we have roughly pretty much consistently a one-day turnaround time for our advancing access applications, we're able to see the date that we faxed it versus the date that our acceptance was received. So because of that, it sees like we're able to see like when we have a delay or when there's something going on over at Gilead, and we can troubleshoot with our agents to see. At the beginning of the year, some of you navigators may know that Gilead's Advancing Access program was really backed up just because of like open enrollment and all these other things. So people were experiencing like 1 to 2 week delays or potentially more depending on your site. But for us, because of our agents, we were able to more or less cut the line in a certain respect, where we still had like a 2 to 3 day turnaround time, which was still lower than what a lot of people were experiencing. But that date received allows us to kind of cross-reference to see if there's a delay or discrepancy of when we're faxing the applications versus when we're receiving the acceptance. And then your different member ID, the approval dates of when it begins to when it ends, the date that the client was notified, who notified it, and any kind of notes in regards to how the notification was done. So this spreadsheet, depending on your site, is a great resource to just track everything. Your site may have a different form of tracking, but we found this spreadsheet to be invaluable. So when we're notifying clients, so you call Gilead, you get the member's ID info, you call the client, you go over the like different dates, you can confirm if they need to reapply to Medi-Cal or Medicaid, you can confirm if they have another kind of insurance option available to them, and just kind of like reaffirming all of that. We update the insurance information with the pharmacy. Sometimes we'll call it in directly versus just like sending it electronically, just because what we've noticed, especially with some of our non-English speaking clients, is that we'll provide them all the information, and there'll still be like miscommunication in terms of like what is needed. So we take that outside of the client's burden, and we do it directly with the pharmacy to make sure they have all the numbers, that they're testing claims with the numbers to make sure that they're being processed correctly, and that there's no issues or no like that there's really like no issues in terms of them being able to access their prescription. And then we update the spreadsheet. Date received for us means the date that we received the approval from Gilead, so yeah. The spreadsheet in a lot of ways works great for this as well. So we do expiration calls where we call clients typically 1 to 2 weeks prior to when they're set to expire. So we remind them if they need to apply to Medicaid or Medi-Cal. We coordinate their applications if they're eligible to apply to Covered California during open enrollment. And we're able to see if we need to reapply or do anything else, or if they just need an extension. So we're able to troubleshoot that with them. During open enrollment this year, we had about 180 individuals that qualified for an Affordable Care Act plan. So my team and I called all of those individuals prior to when they were going to expire. We coordinated appointments for Covered California to have them come in and do the application with them. Everyone on my team is Covered California certified, so we're able to do that with them. Or we're able to see if they're not planning to apply to Covered California, then just doing extensions or doing a new application depending on what their actual dates look like. So the spreadsheet works in a lot of ways to track who is still active on advancing access, tracking to make sure they're all being notified and that they're all being followed up with in terms of when they're set to expire. So refill request and express refill. So our clinic doesn't have an internal pharmacy. I don't know if you were able to tell that so far from the presentation, but we don't have an internal pharmacy. So when we send prescriptions, we're sending it out to Walgreens, CVS, mail order pharmacies, depending on what clients' insurances allow or what their preference are if they have no restrictions. So in any given day, we'll get refill requests from these different pharmacies requesting for new prescriptions. So this allows us to follow up with the pharmacy to see if there is an active prescription on our end that we have on file, confirming that with the pharmacy to make sure that everything is in order with their prescriptions. We are able to authorize refills depending on if for some reason a prescription wasn't sent or if they just need a bridge refill while they come in for the next follow-up with us. Or we follow up with the client. If we see in someone's account that they haven't been in 4 or 5 months, which happens sometimes, then we're able to follow up with them, schedule them for a follow-up to get them into the clinic and renew their prescription. All right. So now I'm going to go into some of the best practices in regards to navigation. So like I mentioned before, just in case people came in later in the call, some of the programs like the Gilead Copay Card or the Patient Advocate Foundation, those will be sent in slides at the end of the presentation that has a full guide of kind of like how to maximize it, common errors or like mistakes when it comes to utilizing it. So I'm not going to spend too much time on those systems just because I think what we're doing at the clinic is a little more valuable in terms of how it could potentially benefit your site. So as we all know, kind of the burden of the epidemic has always been Black, Latin, young people, and trans women. So when a lot of different sites and a lot of different departments of public health and so forth talk about priority populations, they're typically looking at Black, Latin, youth, MSM, and trans women. So because PrEP navigation is something that you can really teach, that there are systems in place that you can teach a new navigator, it really is a great place to hire people from those communities. So as you can see from just so far what I've discussed, your navigators, or at least the navigators at our site, are doing a lot of the constant contacting with the clients, troubleshooting with their pharmacy, getting them in for appointments, helping them assess any kind of insurance change or challenge that they're facing. So they are one of your greatest assets at your site if you're able to have a navigator. The main way that we're seeing people learning about PrEP is through word of mouth. So hiring people from the communities that you're aiming to prioritize and support allows people to really see themselves reflected in the work. And people say it over and over again, but it really is like one of the biggest assets in adherence and uptake in communities of color, young people, and trans individuals. So like in my intro, what Linda said, in the time that I've been the PrEP manager at San Francisco AIDS Foundation, we've seen a double uptake in communities of color. So last year we enrolled a little over 600 Latin identified individuals onto PrEP. And in this past 6 months, we've already passed that number. So we're set to do double the numbers of Latin individuals that have had an uptake in PrEP. And that's because they're seeing themselves reflected in the navigator. So 3/4 of my team identify as Latin. And everyone on my team is bilingual. So when people are spoken to in the language that they're most comfortable in, if they see themselves reflected in the communities that, in the staff that you have, then it allows them to feel more comfortable and feel welcomed in the space and continue to come back to you. And they will call you and email you if they have questions, sometimes a little too much, but it's great and they're really engaged because of the relationship. Here's some of the hiring practices. So again, hiring from the communities that you're aiming to support. So all of the navigators at my site are bilingual. We're from at least one priority population, and we're all trained as HIV test counselors. So it allows us to have that better rapport with our clients. If you have different communities that you're seeking to prioritize, and they go through the entire process of PrEP and not see themselves reflected in any of the staff members, then I know for myself, I would definitely question it, whether I'm at the right site or whether it's the right thing for me. So by hiring intentionally communities that you're seeking to prioritize, it allows people to feel welcomed and to have that ongoing relationship with you. Covered California related stuff. So like I mentioned before, everyone on my team is a Covered California certified enroller. Covered California actually doesn't allow new sites to become enrollment sites, but individuals can collaborate with a site to become a counselor with their site. So if you work with an organization that is an enrollment site, then you can work with them to have individuals trained as counselors under that site to still have access to have enrollment counselors as a resource to your communities. One of the challenging parts with agents or counselors that aren't from your clinic is sometimes they may not know the ins and outs of PrEP or may not have kind of a client-centered approach when it comes to selecting an insurance option. Some agents are paid by application, which doesn't mean that they don't factor it in, but sometimes the motivations are different than if they're at a site and they're a client of yours and you're working with them to get the best health insurance coverage for what their needs are. So some questions to consider is always like a client's income and if they have other healthcare needs outside of PrEP. As navigators, our role is to make sure that they have continued access to PrEP, but a client may have other medical needs, other potential like surgeries that they're looking or interested in or needing. And by having those conversations, you're able to assess what the best options for them are. Some quick info, bronze plans work great at free clinics right now because the lab fees associated with PrEP are covered by free clinics or by sliding scale clinics, except for Kaiser. So as many of you know, with the Kaiser copay issue at the pharmacy, Kaiser doesn't accept the copay card at the pharmacy, so individuals are responsible to pay upfront and then get reimbursed. So with bronze plans, the prescription costs $500 for a 30-day supply. So a lot of times individuals are choosing bronze plans because it's the cheapest option. So depending on their income, they're not really able to pay $500 every month and then wait 6 to 8 weeks to get a check in the mail. So it really doesn't make sense with Kaiser until they're able to really fix their copay issue. That's been an ongoing issue in the community since PrEP's been rolled out. Silver, gold, and platinum plans work with all providers. So a silver plan is kind of your bread and butter for individuals who don't have too many ongoing medical needs and want baseline coverage for everything. A silver plan really allows people to access healthcare in a lot of intentional and meaningful ways. If you know an individual is eligible for Medi-Cal or Medicaid, apply directly to Medi-Cal and Medicaid to the county program, physically in person. You can do it online if there are barriers to apply in person, but don't work with Covered California to apply to Medi-Cal or Medicaid just because there are so many issues with applications not being released or just like back and forth that could be prevented if individuals apply directly to Medi-Cal. And then some tool, so our site uses Medi-Cal or Medicaid as a special enrollment tool. So if we have an individual that we know will be over income for Medi-Cal in a few months, we have them apply to Medi-Cal anyways, just so that they're fully covered in terms of like full scope health insurance. But also when they become over income for Medi-Cal and get dropped, that qualifies as a special enrollment. So then we can apply with them to select the plan through Covered California. So it's kind of like working the different systems to ensure that your clients are covered with full scope health insurance as much as possible, and then kind of working it to, basically just working the system to ensure that your clients are covered. All right. So other best practices that we do at our site, because we don't have an internal pharmacy, is we do what we call our 3-day follow-up calls. So we will call the pharmacy 3 days after the prescription is sent for new enrollments to see if the client picked up their prescription. So this allows us to troubleshoot with the pharmacist if there were any issues, follow up with the client if they have not picked up and see what's going on, if it's just they didn't have time to go to the pharmacy, if there's other things going on, we're able to check in with them and assess any copay. So we do our best to provide all the information to our clients. Sometimes they forget to present their Gilead copay card to the pharmacist, and then they end up paying their like $20, $25 copay or whatever it ends up being. So we're able to provide that to the pharmacist and work with the client to ensure that they're paying little to nothing out of pocket for their prescription. And then if there are issues, like if the client actually has to go through a mail order pharmacy right away, we're able to assess that with the pharmacist. We're able to do any prior authorizations that might be required with the plan. Or if there's just like a technical issue, we're able to troubleshoot it with them. So it allows a lot of different ways to just continue to engage and see if there are any issues. My team pulls a report every 2 weeks that looks at everyone that no-showed or canceled their PrEP follow-up. So in any given report, so let's say a time frame from January 1st through the 15th, we'll have anywhere from 120 to 160 individuals that canceled or no-showed their appointment. So this report, my team pulls, and we go through to see if the individuals have rescheduled already. Some individuals cancel their appointment and reschedule right away. Some people don't, so we're able to follow up with the individuals that haven't. So we help them reschedule if they just forgot and needed help rescheduling. We check in to see if maybe they've discontinued in the time since their last follow-up, if they've moved out of the area and need navigation support to wherever they ended up moving to, or just kind of troubleshoot with them to see. Sometimes clients just forget. Sometimes they have a lot of other priorities going on, so we work with them to kind of ensure that they don't have a lapse in their medication and have continued access to our resources. So like I mentioned, Magnet is the clinic inside of Strut, which is part of the San Francisco AIDS Foundation. The San Francisco AIDS Foundation actually has 3 different sites. So Strut in the Castro, where we have Magnet and other programs. We have the foundation headquarters, which is at 1035 Market. That's over in the downtown area of San Francisco. And we have our 6th Street Harm Reduction site, which is on 6th and Mission, which works primarily with people who inject drugs, people who are marginally housed, and it's where our Hep C program has been being piloted. So at Magnet, we have all of our navigators, and we're able to do a lot of the work that I've been presenting on. At our downtown site, at 1035 Market, we actually open up the clinic Wednesdays and Fridays for PrEP. So we send a team of a nurse practitioner, a navigator, and a lab tech, where we're able to run the entire day, typically anywhere from 15 to 20 individuals, a mix of PrEP enrollments and PrEP follow-ups. And this site that we opened up for PrEP at our downtown site was intentionally built for communities of color, trans, gender nonconforming communities, communities who do sex work, marginally housed communities, people with a relationship to substance use. So this allows us to have more ongoing and intentional connection with all of our clients, because during each follow-up visit, they'll see a navigator who will make sure that they're not having any issues with their insurance, make sure they still have access to the medication, apply to any assistance programs that may have changed, provide gift cards or transportation incentives for individuals that may need it. So it allows us to do a little more kind of check-in with our clients at our downtown site. We also do more intentional calls to individuals at our downtown site. So checking in to confirm their appointment, rescheduling with them as soon as they no-show, to provide as much support as possible. Depending on your site and potentially your different sites, you may want to consider different practices for what your sites need. So what we saw at our downtown site was people needed more support remembering their appointments. So 2 days before their appointment, we always call. Sometimes we call again the day before their appointment to make sure that they're still coming in. With our non-English speaking clients, we provide the pharmacy with absolutely everything and ensure that the claims go through without any issues, to make sure that the baseline that they need to do is just go to the pharmacy, present some form of ID if they need to, and pick up their prescription. So working with the different communities that you're aiming to serve. Another thing that we do for individuals that are marginally housed or don't have a kind of like safe storage space is we work with pharmacies to cut the prescription or put the prescription in little bubble packs. So like traditionally a PrEP bottle will have 30 pills. Sometimes we're able to work with pharmacies to do a bubble pack where they're being dispensed 1 week at a time for individuals that are concerned about getting their medication stolen on the street or don't have a safe place to store it if they are living in an encampment. So this allows them to, it's tougher to replace a full bottle of Truvada, but it's easier if it's just like a few days worth, or that's what we've been able to see. And some of the clinic or some of the pharmacies that we do work with will go to encampments to deliver the medication. So if we know an individual primarily stays in X part of the city, the pharmacies that we work with are able to send their outreach rep to that encampment to kind of see where the client is and provide them the medications. So different systems that to consider when you're using, when you're working with different populations and seeing what makes the most sense to like if you're looking to serve XYZ community, what are the systems in place that you can do to maximize their access to the medication and other like resources that they may need. One thing that we saw a lot since we serve a lot of undocumented individuals at Magnet is the need for asylum resources. So this past month we launched an asylum drop-in clinic at Strut where individuals can come in every second Saturday of the month to meet with an asylum attorney or immigration attorney to learn more about the asylum process, troubleshoot with their asylum case, or work with them kind of like if they are having issues with their like immigration or with their citizenship status. So identifying those needs and working to see what you're able to do at your clinic to support those individuals helps a lot to have it all in one kind of place to go. So looking ahead, so some of y'all may know about the PrEP Assistance Program or PrEP app. So we are a free clinic over at Magnet, so we're not tied to some of the barriers that other sites are in terms of getting the labs covered. In the addendum at the end with the different resources, there is a slide that looks at how we cover all of our labs, but we're not restricted to, basically the only time people have to pay is at the pharmacy, and we work all the navigation tools to be able to ensure that people have access to their prescription. But for sites that don't, that aren't able to cover the lab costs associated with being on PrEP, PrEP app will help individuals. It has the same eligibility as advancing access. So again, that 500% of the federal poverty line, or 60K and some change and below. They will need to be a California resident, so this is California specific. Other states like Washington and New York already have programs like this, but this will be California's. It's set to roll out for uninsured individuals in the spring. So what that will mean is individuals who are on advancing access will have their prescription fully covered by that program, and PrEP app will be paying for all of their labs or treatments that they need in relation to their PrEP care. And there will be a fall rollout for insured individuals that will again cover any lab costs associated with getting the prescription. And if an individual exhausted their Gilead copay card, then the program can be used to pay for any copays they may have. There is still working out some of the kinks, so there are different proposals in how it will be rolled out, like looking at access for individuals who are under the age of 18, looking at coverage in relation to PEP. But so far, those recommendations haven't been put in place into the program yet, as far as I know. So this is kind of like where it's at in its initial form. But this will be a huge resource, again, for individuals who have bronze plans, who may not have been able to access the prescription because of the lab fees associated with being on PrEP. This will cover those lab fees, assuming they're within the income bracket. Generics. So generics, depending on your site, may have a mixed relationship in terms of if your prescribers will even talk about it or what your relationship is to generics. So the patent for Truvada is set to expire in 2024. Parts of the patent have already expired and are expiring. I think one expired last year, another one set to expire in 2021. Patent laws I'm not versed in, but basically generics will eventually be able to be prescribed in the U.S. People still access generics throughout the world. Depending on your site, you can talk about the different generic options that are commonly used and inform clients that it is available. There are kind of some popular sites that people use. I won't really go into too much of it, but if you have more questions around generics, at our site, it is kind of we do use them in a way depending on the client's needs and insurance options. We're able to talk to them about the option that would be to access the generic option if there's no other form that they'd be able to access a prescription of PrEP with their insurance. So people think that generic automatically means that will be so much more cheaper, that will be like $15 for generic Truvada or something like that. It doesn't. And one of the challenging parts with the generic Truvada is that we don't know how much cheaper it will be. Some pharmaceutical companies might make it a few $100s cheaper, but depending on someone's plan, if they don't have the assistance programs in place, similar to Gilead that they've had in place for Truvada, then it may not actually be cheaper for clients to be on the generic version, which can be counterintuitive in terms of insurance companies. If an insurance company says, hey, you're using this really expensive medication, there's a generic option, but the generic option ends up being more expensive to the client because there aren't assistance programs, then the client will be kind of caught in the middle, and it will be our roles as navigators to really troubleshoot and work with individuals to make sure that they still have access to the medication. PrEP on demand. So depending on how you word it, some people call it PrEP 211 or event-based PrEP. It's been approved in France and I believe a few other European countries. In the U.S. right now, PrEP is only able to be prescribed as daily. So one thing that our site is working on is working a pilot program to look at on-demand PrEP or PrEP 211, where individuals take 2 tablets before an encounter, one the day after, and then another the day after that. It's not, depending on someone's sex life, it may make sense for them, and for some, it may not. If individuals are having sex more than once a week, then it probably makes sense for them to be daily, but we know people have different sexual lives, so they're able to access PrEP 211 if that makes sense for them. So we're working on the pilot, and hopefully by summer we'll be able to launch it to kind of support individuals whose lifestyles this makes sense for. And then, so the last few things I want to leave y'all with. So this is kind of my team's motto that we tell our clients multiple times during each encounter, each visit, each phone call. It's to contact us if you have any issues with their insurance at the pharmacy or with the medication. That ongoing messaging allows individuals to really hammer it in that, hey, I'm at the pharmacy, this issue is coming up, I know who to call, or hey, I'm having issues like this medication, like I'm starting to like feel weird after starting it, let me give them a call. Oh, my insurance just changed, or oh, XYZ. They call us and they're able to get it taken care of. This is my contact info. We have our protocols online as well for a lot of the other assistance programs that aren't on the slide deck. The slide deck will have kind of like more in-depth of like how to use and maximize the programs, and the protocols kind of have everything on the 101. So my team trains all of the new PrEP navigators in the Bay Area, and we've been training folks throughout California and throughout the country in PrEP navigation. Last year we hosted a PrEP navigation boot camp that was a 2-day training in partnership with our Department of Public Health, where we trained all new navigators on the ins and outs what is health insurance, what is PrEP, what is PEP, what are the resources, going into all the systems in place for navigators. We'll be offering this again this year. We're still planning our dates, but this will be another resource that we offer. We do one-on-one shadowing at our clinics as well. So if you are a PrEP navigator or have a PrEP navigator at your site and you kind of want some more like in-depth one-on-one time with my team and I, it's something that we offer. So definitely reach out and we can coordinate that. I think we're going to go into some questions.
Yeah, we have quite a few questions, and I'm trying to categorize them. So just very quickly, we have a number of questions on undocumented.
Yeah.
And I know you spoke a little bit about that with advancing access can help depending on the income, but that people are still being denied. That they're hearing from their clients that even with they're meeting their income requirements, but they're still being denied. Do you have some examples of successful undocumented citizens that have actually gotten approval?
Yeah, that's weird. So depending on the denial, like it might just be an application type of error. We've had undocumented people on advancing access for years. And depending on their insurance options, Gilead is great in terms of allowing them to reapply every time. The only time Gilead really denies people access to advancing access is if they're over income or if they've exhausted their membership pending Medi-Cal or Medicaid. But typically, undocumented individuals don't qualify for Medi-Cal or Medicaid just because there are residency requirements to be on those programs. So if you are getting denials, I'd love to kind of chat with you more about that and what that looks like, since there are no restrictions for undocumented people to be on advancing access. The barrier right now is in terms of the actual lab costs, which PrEP app will be able to cover once it gets rolled out. But other than that, in terms of being on the program itself, there aren't really any barriers, assuming they're within the income limit.
Okay. So that takes care of a number of those in that category. Quickly, a quick question. Do you have a consent form that you could use to discuss client information with pharmacies? If so, can you share it? Is that part of the resources?
Yeah, so we don't have a consent form with pharmacies. Since you are a prescribing office, you're able to work with the pharmacy directly. The challenging part is if you're not a prescribing office, like if you're a navigator that's not tied specifically to a clinic or a doctor's office, that's when you'd want to develop different tools to be able to talk to the pharmacy about specific clients. And that would be a consent form that unfortunately we don't have a template for, since we are a prescribing doctor's office.
And do you see minors? And if so, how do access patients assistance programs work for them?
Yeah, so we actually just enrolled our youngest client not too long ago. So they're 15 years old. So in terms of individuals under the age of 18 accessing PrEP, it really depends on their insurance. So Medi-Cal or Medicaid is great if they're on it because it will cover PrEP for individuals, I believe, 12 to 13 and up. So people are able to access the prescription without any issues. If someone has private insurance through their guardian or parent, then that's when you want to work with the young person to see if they have confidentiality concerns, like if they're not out to their parents or don't want them to know that they're specifically on this medication. California has some confidentiality laws, but they're not perfect. So really working with individuals to see what makes the most sense for them. And one of the, unfortunately, the copay card is for individuals 18 and above, so they wouldn't get copay support in that respect. But with the PrEP app program and some of the recommendations for the rollout of it, there are conversations of having individuals who are 18 and under having the prescription covered in full, so that would be one way. Otherwise, kind of what I was talking about in terms of like the generic option for individuals, if they have the funds to order them, or working, depending on what your site's funds look like, to pay for those prescriptions.
So we still have a number of other questions, and as we discussed in the beginning of the webinar, we would type them all up and send them once they're responded to as an attachment to the recorded version of this webinar. So I want to honor everyone's time in that we said we would end at 1 o'clock. We will type up the rest of these questions and get that all back to everyone who has registered today. I want to thank everyone for participating, and I want to thank you, Felipe. This has been a really important and timely webinar, and I can see from the questions and the number of participants that there's quite a lot of interest in this topic. So we'll send you all the recorded version with the slide set as well as the question and answers in the next couple of weeks. Thank you all very much.
Thank you.